Part 2 of Legalities and Ethics. So why do patients sue? Who really knows the real reasons why patients sue? There are documented reasons, such as patient is angry because they were not satisfied with their health care outcomes or they lost a loved one. The patient or family member is hurt or injured during care. Sometimes they may sue just to try and make a quick buck, so to speak. It's hard to believe, but there are people in this world that like to sue everyone for every little error, and sad to say, most times they win their case. So some of the listed hot buttons for lawsuits are medication errors, poor history or assessment, poor physical examination, failure to consult, faulty diagnosis, anesthesia problems, failure to provide care, complications of cesarean sections, and negligence in the manual delivery of care to infants. The most common clinician malpractice lawsuits are medication and treatment errors, lack of observation and timely report on the patient, use of defective technology or equipment, infections caused or worsened by poor care, poor communication of important information, and failure to intervene to protect a patient from poor care. Here are some tips to avoid legal ramifications. Listen to patients and families. They usually sue because they are angry. Stay within the scope of your nursing practice acts and your professional competency level. Act with the client's safety foremost in mind. Know your agency's policies, standards, and/or procedures. Seek continuing education opportunities to increase cognitive, psychomotor, and affective skills. Maintain and understand your professional liability insurance. And promote nursing input by volunteering to be on committees that review incidents. So let's review a few definitions to prevent harm. Battery. It's harmful or offensive contact with the intent to contact, and is caused by the person who is the defendant in a lawsuit. If the act of touching or injuring actually takes place, the act is called battery. Medical treatments and procedures done without prior consent may be considered assault and battery, with the exceptions made for emergency treatment. Assault is the fear of immediate harm from battery, an intentional act of one person that causes another person to fear that she or he will be injured or touched in an offensive way. Touching does not actually need to occur. False imprisonment, confining a person to an area by force. This could be a little tricky because you think about those patients that are in isolation and not able to come out of their room due to the possibility of contamination. This could lead to actually false imprisonment. You have to really be careful with this. Defamation. Word of mouth. Verbal comments that can harm a person's character or reputation. Slander is written information that can harm a person's character or reputation. Dumping. Dumping patients is ethically and morally wrong. There have been cases where hospitals have called taxi cabs to take a patient to literally nowhere. They give the cab driver a random address. Then recently, there was a case where a hospital provided a bus ticket for a patient. It took this patient out of state with nowhere to go or no destination in mind. Okay, now we have research. Experimentation in the past was conducted on people without consent, generally conducted on children or mentally challenged patients. The Nuremberg Code implemented requires any human research or experimentation can only be done with the thorough consent from a patient involved and should have legal capacity to give consent. Credentialing is a process of receiving continued education, staying current with procedures, laws, and standards of care based upon evidence-based practice. One center is the American Nurses Credentialing Center, ANCC. The ANCC is a subsidiary of the American Nurses Association. It is to promote excellence in nursing and healthcare globally through credentialing program. There are other organizations that offer credentialing and continued education. And you want to maintain and keep up to date your licensure and registration. Once you get a license in the United States, in your initial state, and that means having an actual license number assigned to you, you are free to endorse that license to another state, but not until you have the actual license number. Once you take the NCLEX exam, the exam has reciprocity, meaning that you do not need to take it for another state. Your score is accepted by all states. To endorse, the exam score can be used, but that is only part of the licensing process. Some states have language requirements. Others have extra classes that need to be done, like Florida and New York. The Nurse Licensure Compact is an agreement that allows mutual recognition of a nursing license between member states in the United States of America. It was enacted into law by the participating states, and member states allow a nurse that resides in and possesses a current nursing license in a state that is a member of the NLC to practice in any of the other member states without obtaining additional licensure in that state. It applies to both registered and practical nurses, and it is also referred to as a multi-state licensure. While a nurse's license may be multi-state, permanent relocation to another compact state requires obtaining licensure in the new state, as their residency has changed. Likewise, a license obtained in a compact state that is not one's primary state of residence is not mutually recognized by the other NLC members. You could check and see which states are compact states by following this link. Performance of health-related tasks by unlicensed persons is predicated upon an assessment and determination by the registered nurse that the health-related activity under consideration is appropriate for performance by each unlicensed person with each individual patient. Non-nursing functions not involving direct patient care require professional nursing knowledge and oversight, but do not need case-by-case assessment and decision-making by the registered nurse. It is the nurse's obligation to determine tasks that can be reasonably be assigned to unlicensed persons. Missouri State Board of Nursing does not require continued education, but your organization that employs you may require continuing education. It is beneficial to attend continuing education, providing you with current standards of care that is based upon evidence-based practice. Informed consent has many legal ramifications. The client must be provided with information about a procedure or treatment that informs the client of the benefits, the risk, and alternatives, as well as the problems with not having the procedure and/or treatment. Consent must be given without coercion and may be withdrawn at any time the client changes his or her mind. To gain a patient's consent, the RN should ask, can your patient understand the information about the procedure, including the alternatives? Can your patient think and decide and communicate his or her decision about the procedure? And can your patient understand the consequences of their decision? The patient also has the right to decline treatment or refuse consent. At this time, the RN would have the patient sign an AMA form, known as the Against Medical Advice form. Follow your organization's policies when encountering patient refusal of treatment. Advance directives are documents that competent people execute to have control over their future health care. Examples are living will and durable power of attorney. A living will indicates that the patient's life is not to be sustained by extraordinary measures. This document is not legally binding, but it does provide the patient's health care wishes. Durable power of attorney provides the patient to assign another individual to make their health care decision. If it is signed and notarized, this document is considered legal and binding. A DNR order is a do not resuscitate order. This doesn't mean we don't treat the patient. This means we do not do life-saving measures such as CPR or mechanical ventilation. Okay, let's discuss some legalities. Patient abandonment may include, but is not limited to, the following scenarios. Leaving the place of area of employment during an assigned patient care time period without reasonable notice to the appropriate supervisor so that arrangements can be made for a continuation of nursing care by qualified others. Leaving the workplace without adequately providing patient status report to oncoming qualified personnel. Leaving an emergency patient care situation that would be considered overtly dangerous based on the standard of actions of a similarly qualified, reasonable, and prudent licensed nurse. Showing lack of competent attention to or leaving a patient in acute distress without proper notification of appropriate personnel and/or without making appropriate arrangements for continuation of nursing care. Making inadequate patient contacts, assessments, or interventions either directly or indirectly through improper supervision of other nursing care providers. And another one is sleeping while on duty. Fetal medical care is the continued provision of medical care or treatment to a patient when there is no reasonable hope of a cure or benefit. This may be in the form of a surgeon operating on a terminal cancer patient or doctors keeping a brain-dead person on life support machines for reasons other than to procure their organs for donation. It is a sensitive area that often causes conflicts between medical practitioners and patients or family members, who expect everything possible to be done for their loved ones, regardless of the cost or implications for other patients. In America, competent adult patients have a right to refuse unwanted medical treatments. For incompetent patients who have made no advance directive, the family ordinarily makes decisions about medical treatments. But in many healthcare facilities, problems arise in choosing a surrogate to make decisions for an incompetent patient and in working with that surrogate. Concrete step-by-step procedures for resolving conflict are needed. Every effort should be made to have competent patients fill out advance directives or indicate their treatment preference in the event of loss of competence. Family members may not override decisions made by competent patients, but anyone closely involved with the patient's care may question their competence. The physician generally assesses the patient's competence, but sometimes the courts get involved. The physician may be the appropriate person to choose a surrogate for a patient with limited competence or to make decisions for a totally incompetent patient. The surrogate may be a relative, close friend, physician who knows the patient well, or someone provided by the hospital or the government. Treatment decisions are made within the surrogate patient-physician triad. When different value judgments about the proper treatment conflict, the surrogate may have to mediate to restore physician-to-patient communication, or institutional proceedings through the ethics committee may be needed to resolve disputes quickly, amicably, and at low cost. As a last resort, the case may be referred to the courts. And then we have assisted suicide. It is suicide committed by someone with assistance from others, typically to end suffering from a severe physical illness. It is often confused with euthanasia, sometimes called mercy killing. Euthanasia is the killing of another in order to relieve dire suffering, whereas assisted suicide is the practice in which an individual provides a competent patient with the assistance, but where the individual brings about their own death, such as when a physician provides a prescription for a lethal dose of medication upon the patient's request, which the patient intends to use to end his or her own life. Discussion of assisted suicide centers on legal, religious, and moral conceptions of suicide and is a personal right to die. Legally speaking, the practice may be legal, illegal, or undecided. It is depending on the culture or jurisdiction. Justice is not the same as law. Justice is the obligation to be fair to all people regardless of their age, gender, race, or any other factors. It is to prevent and undo wrongs. We have laws that provide anti-discrimination. We have labor laws to protect the worker. In Missouri, we have the at-will employment. And then you can also check out the website at the U.S. Department of Labor homepage to check out any laws that are in question. Fidelity includes loyalty, confidentiality, and veracity. Fidelity is the duty to maintain commitments of one's professional obligations and responsibilities. Veracity includes mandated reporting and whistleblowing. Veracity is the duty to tell the truth. Remember earlier we discussed the legal and ethical dilemmas associated with life, a time to be born, such as artificial insemination, in vitro fertilization, stem cell research, surrogate motherhood and adoption, abortion, neonates, contraception, fertility control and technology, and cloning. These dilemmas continue. The key importance as an RN is to respect the rights of others. Note your own beliefs, values, and culture, and do not let it influence your care you provide to your patients. We also identified the legal and ethical dilemmas that surround the life, a time to die, such as age and death bias, lies and statistics, that's basically life expectancy versus lifespan, present age at death, quality of life, competency and capacity, CPR or DNR. Is DNR a form of withholding, or assisted suicide or a form of euthanasia? Withdrawing versus withholding, dehydration, right to die, Cruzon, definition of death, and euthanasia. Remember, the key importance as an RN is to recognize your own dilemmas and do not let your ethical values or morals predict your care for your patient. Involve an ethics committee for ethical dilemmas if needed. An ethics committee is required by JCAHO and important for patients' rights to be reviewed and upheld by a committee or a group versus one individual making that decision. This concludes this lesson. If you have any questions related to the content of this lesson, please notify the instructor.